Hello everyone, my project topic is heart attack prediction system. Abstract cardiovascular disease is one of the most fatal condition in the present world. Statistical data display the lethalness of cardiovascular disease by relieving the percentage of deaths worldwide caused due to the heart attacks. Thus, there is an implicit necessity to predict the condition of a condition at the earliest. By utilizing the patient medical records, a new system is proposed to predict the chances of person contracting heart attack. Attributes such as age, blood pressure, thickness of the artery, etc., are fed into fuzzy means algorithm, which is used to predict risk of heart attack in a person. Fuzzy means is a clustering algorithm which allows one piece of data to belong to multiple literature survey. Literature survey, the healthcare industry collects huge amount of healthcare data which unfortunately are not meant to discover hidden information for effective decision making. Discovering of hidden pattern and relationships often goes unexploited. Association rule represent a promising technique to improve art disease prediction. Unfortunately, when association rules are applied on a medical data set, they produce an extremely large number of rules. Most of such rules are medically irrelevant and the time required to find them can be impractical. This healthcare environment is still information rich but knowledge poor. There is a wealth of data available within the healthcare system. However, there is a lack of effective analysis tool to discover hidden relationship in data. Today, medical services have come a long way to treat patients with various diseases. Among the most lethal one is heart disease problem, which cannot be seen with a naked eye and come instantly when its limitations are reached. Today, diagnosing patients correctly and administering effective treatments have become quite a challenge. Existing system. Very few systems use these available clinical data for production purpose, and even if they do, they are restricted by large number of association rules that apply. Diagnosis of conditions slowly depends upon the doctor's institution and patient record. The disadvantages are detection is not possible at the earliest stage. If in the existing system, practical use of various collection data is time consuming. Proposed system. The proposed system acts as decision support system and will provide and will prove to be an aid for physician with the diagnosis. The algorithm fuzzy means use clustering and makes use of clusters on data points to predict the relativity of an attribute. Each data point is associated with multiple clusters depending upon the membership degrees. Advantages: high performance and accuracy rate. Fuzzy C means is very flexible and is widely in various domains with high rate of success. System specification. System requirements: MS Windows XP and above, MS Visual Studio .NET 2005, MS SQL Server 2000. Hardware requirement: hard disk greater than 15 GB, RAM greater than 1 GB, processor Core 2 Duo and above. Architecture of system. Patient enter username and password or login. Once he login, a patient have to enter his detail that is viewed uh, that viewed by the doctor, and doctor to view doctor have to login. Once the doctor login, he check the patient details, symptoms, and that is updated by patient. The text data was extracted, that is stored in database, and the data is compared with clustering data and classification. Finally, a report is given by doctor that viewed by using fuzzy C that viewed by the patient. Activity diagram. Your user login. If the new user register first, you have to register. If you enter the correct details, that 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 is viewed by the doctor. If we enter incorrect, it come back. The once he enter correct details, login, doctor assist the list of patient and collect the attributes and feed it into the system. The system process data and that give the report. The once he enter correct details, that patient view is detailed history, and that views will update the report. That report is viewed to the patient. Sequence diagram. Patient patient login, heart attack at login. Once he login, he collect the attributes and compare the result, and this result is displayed to the patient. This attributes clustering result database data. The doctor once login, he has collect the data collected from UCI center, and he check the collect the attributes, and he compare the data, and he display the result. This result is displayed to the patient, that viewed to the patient, that viewed by the patient. List of modules. Modules for heart attack prediction are user module, doctor module, clustering user module with the data set already acquired from the UCI machine learning respiratory. We can now proceed with collecting details of patient data like patient name, blood group, address, phone number, sex, weight, height are collected from patient themselves. To the help with creation of an individual user account already registered, user can directly started assist the system with the help of user ID and code provided. Doctor module. Doctor view all the patient details and their medical history. Doctor with the help of medical record punches the value of attributes which is fed into the FCM for clustering purpose. The attributes used are given: age, sex, chest pain, rest, BP, cholesterol, sugar, ECG, max heart range, allergena, old peak, slope, results, thalassemia. The result is a screen that displays the chance of person contracting heart attack. The system then produces a list of suggestions for the person with the given use case diagram. Use case diagram of doctor. You view the patient details and correct the attributes from patient. We use case of patient. We view the history, and we view the updated information by the doctor. Clustering model. We employ fuzzy C means clustering, which is adopted for clustering medical data. The data given by doctor and patient has been fed into the algorithm. It is now the job of clustering algorithm. Data clustering is process of dividing data element into classes or clusters so that items in the same class are similar as possible and items in different classes are dissimilar as possible. Fuzzy sim is clustering. Fixed number of clusters, one centroid per cluster. Each data point may belong to one or more cluster depending on degree. The centroid changes based on the degree. This diagram is going to explain about cluster at one centroid. The centroid. By utilizing the patient medical records, a new system is proposed to predict the chances of person contracting heart attack. Attributes such as age, blood pressure, thickness of the artery, etc., are fed into fuzzy C means algorithm, which is used to predict risk of heart attack in a person. Fuzzy C means is a clustering algorithm which allows one piece of data to belong to multiple colors. A fixed number of cluster, one central per cluster. Clusters are fuzzy set. Membership degree of a point can be any number between 0 and 1. Sum of all degree for a point must be added up to 1. This figure is going to explain about centroid per cluster. Existing system. Very few systems use these available clinical data for production purpose, and even if they do, they are restricted by large number of association rules that apply. Diagnosis of conditions slowly depends upon the doctor's institution and patient record. The disadvantages are detection is not possible at the earliest stage. If in the existing system, practical use of various collection data is time consuming. Proposed system. The proposed system acts as decision support system and will provide and will prove to be an aid for physician with the diagnosis. System specification. System requirements MS Windows XP and above MS Visual Studio .NET 2005 MS SQL Server 2000 hardware requirement are digital. The page is fill paper you have to fill this details, patient details, patient name, age, sex, chest pain, rest, BP, cholesterol, fasting of blood pressure, resting electrocardiographic marks at heart rate, Helena, whole peak, low, vessels, thalassemia, smoking, and check once he details. These details will display. Heart attack analyzer will be display. If everything is normal, heart attack analyzer will be display. Sequence diagram. Patient login, heart attack at login. Once he login, he collect the attributes and compare the result, and this result is displayed to the patient. This heart attack. Doctor viewed patient details here. We have to view the patient details that entered by the patient. This will be displayed on doctor page. Conclusion. Purpose is a FCM clustering algorithm for the predicting the risk of heart attack in a patient using attribute collected from the doctor. Proper adoption of the FCM clustering the data into an optimum number of clusters and aids with detecting the normal and abnormal case effective provided. Doctor module. Doctor view all the patient details and their medical history. Doctor with the help of medical record punches the value of attributes which is fed into the FCM for clustering purpose. The attributes used are given age, sex, chest pain, rest BP, cholesterol, sugar, ECG, max heart range, allergena, old peak, low, results, thalassemia. The result is a screen that displays the chance of person constructing heart attack. The system then produces a list of suggestions for the person with the given. Thank you.